So Anand Iyer, President, Chief Operating Officer of WellDoc, and several people asked this question about, how did we get started and what were the challenges? And we were actually born from the clinical frustration of an endocrinologist, Dr. Suzanne Clough, back in 2005, who was practicing as an endocrinologist at the Joslin Center for Diabetes, University of Maryland. And it was really born from her frustration that here in arguably the finest institute in the world, where she had the podiatrists, nutritionists, educators at her side, she couldn't make a difference in outcomes. And she felt, in her own words, as though it was teaching a foreign language to this patient in 4, say, 5-minute offices that scattered throughout the year. But the aha moment was that every patient who came in to see her, regardless of their socioeconomic status, had a cell phone. And this is back in 2005, before the word app and iPhone existed in our language, right? And so just think about it. She asked a very simple question that if I could not just capture data, but if I could give real-time feedback at the point of consumption, at the point of care, could I affect better behaviors on the side of the patient, and could that lead to better outcomes? In our first clinical study that Dr. Clough conducted, we actually improved patients' A1C, so the gold standard marker for diabetes management, by over 2 points. Now, put that in perspective, the FDA heralds a drug that drops it by 0.5 point, and the top 15 drugs in the market today reduce it on average 1.1 points. And so a 2-point reduction is not, people are asking us, what are they doing, swallowing the phone? We said, no, they're doing what their doctors told them to do. And that's really how the company got started. And I think when you start to think about the challenges are multiple. The challenges are, how do you get physicians engaged? Because ultimately this is about bringing the patient and the provider closer together. And that means, how do you incent them? How do you integrate into their workflow? I think another challenge is how do you actually make this part of Main Street health? And that's something that, for example, we're working with CMS. It says, can you get codes? And if you get codes, then the Blues adopt them, the plans adopt them, and then this thing starts to trickle. And I think we're at that point where it's almost going to happen. And I think we're seeing enough momentum. The clinical results are there, proven, published in journals. The economic results are there. The early adopters are there. And now we have enough, if you would, we're starting to build that critical mass that's going to push us to where I think the larger systems will start to adopt this. And then that's how I think physicians will benefit and continue to proliferate these types of solutions in the future.